Diazepam, also known as Valium, is a medication used to treat anxiety, alcohol withdrawal, and seizures. It is also prescribed to relieve muscle spasms and provide sedation before medical procedures. This medication works by calming the brain and nerves, and it belongs to a class of drugs called benzodiazepines. The usual dosage for anxiety is 2 to 10 mg, 2 to 4 times a day, while for alcohol withdrawal, it is 10 mg, 3 to 4 times during the first 24 hours, reducing to 5 mg, 3 to 4 times a day. For muscle spasms, the usual dose is 2 to 10 mg, 3 to 4 times a day. The optimal timing for taking Valium may vary depending on the condition being treated, so it is important to follow the instructions of your healthcare provider. It is important to note that Valium can be habit-forming, so it should only be used as prescribed and for the shortest possible time. Additionally, suddenly stopping Valium can cause withdrawal symptoms, so it is important to gradually reduce the dosage under the supervision of a healthcare professional. If you have any concerns about taking Valium, consult with your healthcare provider for personalized advice. Be sure to carefully read the medication guide provided by your pharmacist before starting Valium and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take Valium by mouth with or without food as directed by your doctor. If you are using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. If you are using the concentrated solution, use the medicine dropper provided and mix the measured dose with a small amount of liquid or soft food, such as applesauce, pudding. Take all of the mixture right away. Do not store the mixture for later use. The dosage of Valium is based on your medical condition, age, and response to treatment. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Properly stop the medication when so directed. When using Valium for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, Valium may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Avoid eating grapefruit or drinking grapefruit juice while using Valium unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. Ask your doctor or pharmacist for more details. If directed by your doctor, take Valium regularly to get the most benefit from it. To help you remember, take it at the same times each day. Tell your doctor if your condition lasts or gets worse. Some common side effects of Valium include drowsiness, dizziness, tiredness, blurred vision, or unsteadiness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential side effects. Many people who use Valium do not experience serious side effects, but it's important to contact your doctor immediately if you experience any serious side effects, such as changes in mental or mood, trouble speaking or walking, muscle weakness, shaking, trouble urinating, yellowing of the eyes or skin, signs of infection, or slow/shallow breathing. Allergic reactions to Valium are rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects that are not listed. Diazepam, also known as Valium, is a medication that can be addictive and has a risk for abuse, which can lead to overdose and death. It's important to take this medication exactly as prescribed by your doctor and to avoid drinking alcohol or taking other drugs that can cause drowsiness or breathing problems, such as opioid medications like codeine and hydrocodone. Your doctor will prescribe the smallest effective dose of diazepam for the shortest possible time to help lower your risk of serious side effects. It's important to understand how to take diazepam and to know which other drugs to avoid while taking it to prevent any complications. If you experience any serious side effects such as slow or shallow breathing, severe drowsiness, or difficulty waking up, seek medical help right away. Additionally, suddenly stopping this medication may cause serious withdrawal symptoms, especially if you have been using it for a long time or in high doses. Your doctor may gradually lower your dose to prevent withdrawal symptoms such as headaches, trouble sleeping, restlessness, confusion, or seizures. It's important to communicate any concerns or symptoms with your doctor or pharmacist to ensure the safe and effective use of diazepam. Before taking Valium, make sure to inform your doctor or pharmacist if you have any allergies, especially to other benzodiazepines, or if you have any other medical conditions. It's important to discuss any history of muscle disease, breathing problems, mental disorders, substance use disorder, glaucoma, liver or kidney disease with your doctor or pharmacist before using Valium. Valium may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol, marijuana, and using heavy machinery while taking this medication. Some liquid products of Valium may contain alcohol, so be sure to ask your doctor or pharmacist for more details. Before undergoing surgery, it's essential to inform your doctor or dentist about all the medications and herbal products you are using, including Valium. For some children and older adults, Valium may have different effects than usual. It's important to discuss any concerns with your doctor before taking this medication. If you are pregnant or planning to become pregnant, it's crucial to discuss the risks and benefits of using Valium with your doctor. This medication can harm an unborn baby and may have undesirable effects on a nursing infant, so it's not recommended to breastfeed while using Valium. It's important to be aware of potential drug interactions when taking Valium. Certain medications and products can change how Valium works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Valium include clozapine, fluvoxamine, orlistat, and sodium oxybate. Taking Valium with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines, may increase the risk of serious side effects. It's important to inform your doctor or pharmacist if you are taking any of these products. Additionally, it's important to check the labels on all your medicines, as some may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using those products safely. Valium may also interfere with certain lab tests, which could potentially cause false test results. Make sure lab personnel and all your doctors are aware that you are taking Valium. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or difficulty breathing, it's crucial to call for emergency medical help immediately. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, slow reflexes, shallow breathing, fainting, or loss of consciousness. Remember, it is important not to share Valium with others as it is against the law. If you are taking Valium for a long period of time, your doctor may schedule lab tests to monitor your liver function and overall health. Be sure to attend all medical appointments and follow your doctor's instructions closely. If you forget to take a dose of Valium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When using Valium, it is important to store it at room temperature away from light and moisture. It should not be stored in the bathroom. If you are using the concentrated solution, make sure to discard the opened bottle after 90 days. It is crucial to keep all medications away from children and pets. It is important to not flush medications down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.